Today you're going to learn about a patient who was able to resolve his autoimmune hyperthyroidism or Graves' disease and no longer need medication. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. And I've had the opportunity to see over 100,000 patient visits over the last 38 years, many of whom have gut and thyroid issues, and this patient was no exception. A 47-year-old man came in complaining of fatigue, brain fog, insomnia, decreased stamina and muscle strength. He was overweight, high blood pressure, and had hyperthyroidism or Graves' disease, and had been taking medication for it for over 5 years. So the first thing we did was some comprehensive lab testing. So when you're evaluating your thyroid, you want to make sure you don't just get the basic 4 things your doctor typically orders: CBC, chem panel, chemistry panel, lipids, and TSH. You want to also get ferritin with iron panel, CRP, inflammation marker, LDH, GGT, insulin, A1C, uric acid, free T3 and free T4, and then thyroid antibodies, reverse T3, ANA, and then adrenal hormones. So this is the minimum I would get for a complete thyroid check. Other hormones are nice to see as well: testosterone, estradiol, IGF-1, some nutrients, B12, folate, vitamin D, and homocysteine, and homocysteine and a urinalysis. So besides that, I like to do functional testing to determine root causes. So the 5 categories: deficiencies, toxins, infections, hormonal imbalance, and food reactions, especially gluten and including leaky gut. So he had multiple deficiencies, including selenium, which is very important for thyroid health. He had below optimal iodine, also important for thyroid. He had above optimal mercury levels under toxins. He had infections, candida, yeast overgrowth, as well as bacterial imbalance in his gut, and hormonal imbalance, very low testosterone and adrenal dysfunction, and food reactions. He had celiac genetics and gluten sensitivity with leaky gut. And I almost always see this with autoimmune conditions, and he also had other food reactions as a result. He came in after a month and was feeling so much better, had more energy, less brain fog. His sleep had improved, increased strength and stamina, and his digestive symptoms had cleared up, and he had dropped 16 pounds in that first month. Looking beyond that with his thyroid markers, he was able to gradually reduce his medication to 5 times a week, 3 times a week, twice a week, once a week. Ultimately, at a year, he was able to stop his medication. His thyroid numbers still remain normal, and he came in a year and a half after that, being on no medication. I recently saw him, and his TSH, T4, T3, they were all optimal levels, and ran a thyroid ultrasound, which showed no sign of Graves' disease, and just had 1 small 0.5 centimeter thyroid nodule. And on top of that, when he came in at that month's point in time, other significant labs improvements: his cholesterol dropped over 100 points, his ferritin dropped 50% to optimal levels, same thing with insulin. Liver enzymes decreased over 50% to normal. His testosterone went up over 500 points without taking testosterone, just optimizing his overall health and all these other things. And then at 4 months, his CRP inflammatory marker was down 72% to optimal levels, and he had dropped 28 pounds by that point. He was feeling great. So the diet that I put him on, I call the Free Diet. It's a diet I came up with years ago when I was figuring out how to heal from my own autoimmune thyroid, Hashimoto's condition, rheumatoid arthritis, IBS, fatigue, skin issues. I was able to get better through a lot of testing, trial and error. And I call it the Free Diet because it's free of not only gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, those foods most commonly responsible for inflammation, gut, thyroid, and other health issues. If you'd like a copy of the free diet phase 1 food chart, I'll put a link below and we'd be happy to send that to you along with other resources. I'll also put a video at the end of this, one that explains the free diet in more detail. In addition to diet, the supplements I put him on are the Functional 5, which is multi-fish oil, vitamin D with K, magnesium, and probiotic, along with other nutrients I determined through testing. So that included curcumin for inflammation support, cardiometabolics, which is berberine, alpha lipoic acid, gut support nutrients, liver support, zinc, C, adrenal, and testosterone support. So with that, he was able to normalize his thyroid, restore his energy, heal his gut, and restore his vitality, get to his optimal weight by really addressing the root causes and figuring out what was driving his autoimmune condition. And I believe if you have an autoimmune or other chronic health condition, if you find out what the root causes are and are provided the right solutions, that almost anyone can get better. So thanks for joining me today. I'll put a link to the free diet phase 1 food chart below, and feel free to like and subscribe, and I'll see you next time.